Welcome to my channel. My name is Wendy. I am a registered nurse, and on my channel, I talk about my experiences related to nursing and offer advice and encouragement based on those experiences. Today, I will be giving you tips on how to prepare for your new grad RN interview. Stay tuned. I remember my first RN interview. I had no idea how it was going to be like. When I arrived, it was a group interview. There were 10 candidates with a panel of about 5 to 6 managers and unit leaders ready to ask us questions. And I'll admit, I was not prepared. I wasn't privy to a new grad RN interview in nursing school, and I actually think all nursing schools should include this in their curriculum somehow. Anyway, since then, I have gone to numerous interviews and I've picked up a thing or two. I can't stress enough the importance of preparing yourself. It's the key to a successful interview. So here's how you prepare for your new grad RN interview. First and foremost, research the hospital. Look at their mission statement. You will need this to answer the question, why do you want to work here? And when you're answering the question, use this formula. I want to work here because, then you state the hospital name, is dedicated to, or you can say, the hospital's mission to, and then you're going to explain the mission statement verbatim. Then continue with, is something that correlates with my beliefs in nursing, and I want to be a part of an organization with such beliefs. I know that sounds confusing, so let me give you an example. Okay, let's create a fake hospital. Let's say the hospital's name is 123. So you would say, I want to work here because 123 Hospital's mission to improving the health of the people, especially those who are vulnerable, while advancing social justice for all, is something that correlates with my beliefs in nursing, and I want to be a part of an organization with such beliefs. That's it. It works with any place you apply to. Try it and see. Secondly, go over your nursing interventions. Some of the topics I was giving a scenario to involve topics of septic shock, acute MI, stroke, and pulmonary embolism. For example, I was given a scenario about a patient who is alert and oriented, admitted for a DVT in the right leg. When you leave the room and come back, you observe the patient having difficulty breathing and gasping for air. What is happening to the patient? And as the nurse, what are you going to do? So it's obvious that this patient's DVT has now dislodged and has traveled to the lungs, meaning this is a case of a pulmonary embolism. So you want to know the appropriate steps to take for this patient. So study it well, and don't forget to also learn the appropriate steps for septic shock, acute MI, and stroke. Third, review your EKG rhythms. I feel like I wasn't really taught how to really read rhythms and understand the concepts of EKG rhythms in nursing school. I had to do a lot of independent study for that. I even went to the extent of taking an EKG class to get certified, but that's beside the point. If EKG rhythms is not your forte, you just need to know the basics. Know your life-threatening EKG rhythms. So that's pulseless VTach, 1, VFib, and asystole. Follow ACLS guidelines to these rhythms and also review A-flutter, AFib, PVCs, and PACs. I had an interview where I was given a bunch of rhythms and had to write out what they were. Intimidating, right? Anyways, here are some examples of interview questions I have been asked before. Number 1, patient is alert and oriented, getting ready to eat breakfast. You check blood sugar and it's 26. What are you gonna do? Number 2, you find a patient on the floor. What are you going to do? Number 3, what are the signs of stroke? Number 4, tell me about a time you handled a difficult patient and what did you do? Number 5, Are you willing to pick up more patients within the law if the unit is short? Number 6, give me 3 EKG rhythms that would cause for a code blue. Try to answer these questions for yourself and learn the answers for a future interview. I will make a separate video explaining how to best answer these questions. That's it. Thanks for watching. I hope this was helpful. Have you had an interview yet? What sorts of questions have you been asked before? Let's discuss in the comments below. I'm interested in hearing some of your answers. If you haven't already done so, please join the family and subscribe to my YouTube channel. Until next time, bye-bye.